Is it visible?
Sir.
Is it visible?
It's
In
not
fact,
visible, but it said
Sharing.
he has started screen sharing.
is it visible? No.
No,
Hello?
sir.
Oh my.
No, sir.
Let me share it again.
No, it's visible.
Change हो रहा है?
Not.
हाँ.
Slide change हो रहा है, हाँ? Okay. In fact,
Yes.
you people are aware. In fact, I would like to briefly, very fast, summarize about the key activities, the key initiative taken by RP Center, the Community of Ophthalmology, for National Program for Control of Blindness. One thing which I can definitely say, the definition of blindness, which was 6/60 previously, and now we have the definition as par with WHO, and we are taking blindness as presenting visual acuity less than 3/60 in the better eye. National Blindness and Visual Impairment Survey, in fact, RP Center have been the leader in conducting these surveys. The first survey was conducted by ICMR, but after that, all the surveys have been done by RP Center, and this survey was totally, and then in the entire team was through RP Center only. And beside this survey, which was done in 50 plus population, we all did another survey to cover 0 to 49 age group, so that we can give actually estimates for the entire population of the country instead of just restricting to 50 plus population. And this slide shows that the prevalence of blindness and visual impairment has gone down significantly. With visual impairment as 2.55% at current level, and blindness as 0.36%. And you can see this is a scenario as far as NPCB is concerned. It looks very nice and proud to say that from presenting the blindness of 1.38% in 71-74 survey, now it is reduced to 0.36, which is, and the target were 0.3%. So it is quite close to the target actually. But again, I would like to mention that cataract is still the leading cause of blindness and responsible for nearly 2/3 of blindness. And this corneal opacity, especially the non-trichomatous corneal opacity, has emerged as important cause of blindness, the second leading cause of blindness. And beside this, complication of cataract surgery is another important cause of blindness. This is one thing which I would like to share, that ministry, after this survey, they wanted what is the actual number of cataract surgeries needed in the country. This is the way how we have calculated, use various figures of blindness and different type of visual impairment, and given a number to ministry that we need 2.7 crore, 27 million surgeries for next 3 years, in case we need to actually eliminate the blindness and severe visual impairment due to cataract in our country. National Diabetes and Diabetic Retinopathy Survey, which was again conducted along with National Survey. It was conducted in 21 districts. The prevalence of diabetes was 11.9%, whereas the prevalence of diabetic retinopathy in country is found to be 16.9%. And sight threatening was 3.6% of that one. Dr. Nupur has also mentioned about the National Trachoma Elimination Initiative. In fact, active trachoma was declared eliminated based on the survey which was conducted by RP Center from 2014 to 2017. And it was declared by Health Minister of India that trachoma among children is eliminated, that is active trachoma. And of course, now we are working towards elimination of trachoma sequelae, and the trichomatous trichiasis survey is being conducted all over the country in 200 districts, covering a population of nearly 600,000 people. Another thing is the childhood blindness survey. We know that it is very difficult. You need a large sample size, but fortunately, this survey has been conducted in one of the districts in Delhi, where 20,000 children are covered, and we have data available related to current status of childhood blindness and visual impairment, and the causes, if in especially in Delhi, which is catchment area of RP Center. This is one important survey, the data on human resource and infrastructure in country. We did with the help of NPCB, Orbis, AIOS, and Vision 2020. And in fact, we know that we had a target of 25,000 ophthalmologists and 48,000 hospital-based paramedics. The target was kept in 2004 when Vision 2020 Right to Sight program was started in India. And current status shows that in our country, we have nearly 21,000 ophthalmologists, and that is one ophthalmologist per 65,000 population at present, against a target of one ophthalmologist per 50,000 population. And if you talk about optometrists, then we have approximately one optometrist who is available for like 2.26 optometrists per institute total nearly 17,856 optometrists at the hospital level. It is not about the primary eye care. It is the optometrists who are working at secondary and tertiary level hospitals. I feel very proud to say that we are able to develop this India Vision Atlas, where we have all the data related to these National Blindness Survey, National DR Survey, trachoma surveys, and also National Human Resource Surveys. And anyone can log out to this address and can see the data which is available for our country in this atlas. Primary eye care is important component. In fact, we this study to assess like how to involve ASHA worker in strengthening primary eye care service in country. And this was done in Delhi itself. Based on this study, in fact, we have developed modules for the ASHA worker for health and wellness centers. And now we are very clear that ASHA worker can be involved in eye care services, primary eye care services. They can be involved in health education and also screening for visually impaired patients in all over the country. And this initiative has been included in National Program for Control of Blindness in the recent plan now. And RP Center is definitely showing a model for primary eye care services, the quality primary eye care service in the country, where not only refraction, but we are screening for glaucoma, for diabetic retinopathy. Even schools are being covered under school vision screening program. So it's a comprehensive screening, and along with providing rehabilitation services at the community level. In fact, we are happy to say that we have got support from multiple partners, from CBM, from SSMI, from Deepalaya, and for Hero Motors. And currently 27 vision centers are there with us. And in fact, these vision centers are not there only on Delhi, but we have gone into rural areas in Gurgaon, Tauru, etc., so that we can go to in areas which are not actually the catchment area of RP Center, is beyond this area also. DR, in fact, this model we started in 2013 when we used this non-mediatic fundus camera for DR screening, where our optometrists, they were trained and they can identify various stages for diabetic retinopathy, and then only patient who actually need to be referred to RP Center with some kind of DR, they are actually referred to RP Center. Then cataract region program, it is being run in RP Center. We are providing free of cost phacoemulsification surgery with foldable lenses, free of cost to all such patients who are being referred from our community outreach programs, and a lot of NGOs are being participated in this program, RP Center. Dr. Rohit just mentioned about myopia. In fact, this study was as a PhD study conducted. We showed that in Delhi schools, the prevalence of myopia is nearly 13.1%. And in 2001, when we did the survey, it was around 7%. So you can see nearly double. And in fact, Dr. Rohit mentioned that because of COVID, this number is probably has increased to nearly 20% in Delhi schools at present. And this is one study based on this actually meta-analysis for last 40 years, and different studies which have been conducted in last 40 years in school for school-going children about myopia. Based on this study, actually, we showed target to Government of India, to NPCB, that actually we need to screen nearly 275 million children every year in schools. And out of them, 20 million children, they need spectacles. The current target of NPCB is just 1 million, 10 lakh spectacles. So you can understand the actual targets which have been kept under the national program are just 5% of the actual need for the spectacles in our country. Dr. Suraj has mentioned about the low vision rehabilitation services. In fact, this is important integrated component in our program. This is in hospital-based low vision services, hospital-based rehabilitation services, and also the community-based low vision services, which is being provided in our vision centers. This is one example where we provided a kind of disability certification revised guidelines based on this matrix. Even the health worker can identify the percentage disability based on the best corrected visual acuity in both the eyes. The best part was these guidelines were actually notified by Government of India, and all the hospitals are expected to use these revised guidelines for certification of visually disabled. Recently, WHO has come out with some special global indicators which has to be attained by 2030, that include effective cataract surgical coverage and effective refractive error coverage. We're happy to share that with WHO CRO partners, we developed this field testing to assess these two indicators. I'm here to say that even this refractive error coverage, this was not even calculated in the National Blindness Survey. But now we have this Ravi methodology by which we can actually calculate effective refractive coverage in all age group, starting from school-going children to adults and the people above 35 years for near vision also. So this is a rapid assessment of avoidable visual impairment methodology, and this work has been done WHO. We have already shown these kind of survey in nearly 6 districts so far in our country. So this is very much achievable. Even optometrists can conduct this survey. And Dr. Suraj has mentioned about this rapid assistive technology assessment methods and given details about, and this is one survey which was conducted in India by other partners plus team of RP centers led by Dr. Suraj. So these are the various activities which we were able to show to Government of India and help assist National Program for Control of Blindness. I believe the similar trend will continue, and as Dr. Nupur has mentioned, by the year 2023, we'll be able to definitely achieve elimination of trachoma in our country also. Thank you very much. Thank you. So I believe